Most people know that going to the dentist is probably not the favorite thing that people do in their lives. In fact, 50% of people avoid the dentist altogether simply because of fear. When I first started practice, I took a course in sedation where you can actually comfortably and safely take care of people that are very, very afraid. We have people come into our office that are literally shaking, crying, just walking in the door. And so for us, sedation is just a wonderful gift to all those people who have avoided the dentist for years because of fear.
Patients that may have not been in for a couple decades or more, terrified to even just meet the dentist. Being able to offer sedation dentistry, we're able to give our patients everything that they need or want.
The options for the sedation, there's essentially three. Most people know about the first one, which has been traditional dentistry with what they call the laughing gas or nitrous oxide, which is where you put the mask on your nose, kind of breathe that, and it kind of gently relaxes you. For some people, it makes them feel like a little bit of a trance, like they kind of fall asleep, they just feel more comfortable. That tends to work for some people that have maybe light to minimal, anxiety, or they just, are not comfortable in the situation. The sedation that we do for probably 95% of our people is called oral conscious sedation. It's like the lights are on, but no one's home. We bring the patient in, obviously review the medical history, any kind of drug interactions. Safety is the primary thing that we're concerned with. We judge and titrate exactly how much medicine each person needs based on their height, their weight, their anxiety, so it's all very carefully measured. We actually give people medicine the night before to kind of get the process started, like preload the system. You come into the office, we put you in a nice cozy chair, we have Tempur-Pedic pads, nice warm blanket, some dark sunglasses, music, and then we give you the medicine. And for most people, the medicine takes effect in 45 minutes to an hour. And then we can judge or tell how the person is doing before we start any procedures. You can still respond. You can let us know if you're uncomfortable. So it's not like you're trapped in a bad dream and you can't tell us if something's uncomfortable. We obviously watch your body movements, your pulse, your oxygen saturation, which is how we can tell how you're breathing and your heart rate, blood pressure, all the normal things to be sure you're totally comfortable and safe during that visit. And the most amazing thing about the sedation is sometimes after you take a medicine, you feel lousy after. With the sedation, it just feels like you took a nap, only when you look in your mouth, all your teeth look perfect. The oral sedation is probably what we use 95% of the time. Sometimes either the medical situation for the patient or their personal desire or fear or the procedure we're actually doing, it's safer for people to use what we call IV sedation, which would be closer to what you would think of in a hospital. So we actually bring in an anesthesiologist with the full cart, all the medicines, the safety precautions. Over the last 25 years, we've taken care of thousands and thousands of patients safely. We've been able to give people hope that they can have the work they need accomplished in a safe way.